tell you another story, and why comparative effectiveness is so dangerous to me. And I tell you what, I wouldn't ask my mother or my daughter to go into a system that I know would not allow them to survive breast cancer at the same rate that we have the ability today. And that happens. And I'll tell you why. Let me give you a great example. A 19-year-old presents to the doctor with blood in the urine. Healthy 19-year-old, very athletic, playing football. The doctor's practice comes to the conclusion that person's been jarred. Take a few days off of football, you'll be fine. Thankfully, a doctor in that practice said, you know, I've watched this patient for 15 years. Something's not right. Doesn't seem right. I can't quite tell you. I've reviewed the tests. I want to do further tests. Everyone in the practice says, nope, don't do it. It's crazy. 19 years old, this is all it is. Thankfully, that woman doctor wins out. That patient goes down to a urologist and finds out that they have bladder cancer. The statistics of that were almost impossible to be true. But had that doctor not been able to act on her hunch and her medical science and her history with that patient would have been dead at 26. That patient was me. I take this very seriously. And when you start talking about getting involved between a doctor and a patient, and this bill will do it. Don't kid yourself. This bill will do it. You do it through best practices. You do it through comparative effectiveness. It's the only way you can cut costs. They would have said, statistically, you can't have that person. That person can't have bladder cancer. That person shouldn't have that treatment. That's exactly what they do in Canada. It's exactly what they do in Great Britain. It's exactly what they do in Denmark.
Well,
and you know what? Just real quickly, if you look at the cancer statistics, and I like that because it's the general population, it isn't that anecdotal story. In bladder cancer, survivability in the United States is pretty close to 99% with treatment. In those other two countries, total combined, it's 75. And you know what? It's the same for breast cancer. It's the same for cervical cancer. It's the same for skin cancer. Why? Because they made the trade-off that we're going to stretch this queen sheet over a king-size bed, and we will accept in those countries the fact that some of our young women are going to die of breast cancer. We'll accept that. That's the trade-off that they made. That's what the trade-off this bill presents America. That's why I think if we work together and start saying, listen, we're not going to get it. Let's not even draw that line in the sand. We will not allow a bureaucrat or a politician to get in the middle between that doctor and that patient so they can survive.